And we're back talking, merging Eastern and Western medicine and how it can be the toolbox that we all need to really help us find answers to our health. I am joined today by Jennifer, who's a willing participant. And by the way, any of you guys can be participants. You just have to email me and let me know or leave a message below in comments. But here's what we're gonna do today. Have you heard about dirty livers?
A little bit.
A little, probably from me, right? So we want everyone to understand what it means to have a dirty liver. It really is centered around this Eastern concept that if we're not detoxing, if we're not moving the right foods, emotions, supplements, herbs, hormones through our livers, we will get sick. So today we're going to show you an easy way to assess your general health, specifically your liver health. Jennifer has volunteered to sit with me for just a second, so we're actually going to read her face. So, have you ever had your face read before?
No.
Have you ever had your tongue read before?
No.
So this is the beauty of Eastern medicine. It used very simple diagnostic tools like observation, tongue and pulse reading, and a good physical exam and history to really get to the root of what's happening with a particular patient. And in the world at Center Spring MD, this is exactly what we do every day. We're using Eastern diagnostics, merging it with Western diagnostics, and really able to deliver that East-West approach to medicine, and even bringing the philosophy in, like the philosophy around having a dirty liver. All right, so we're gonna start by just looking at her face. So Jennifer's face is gorgeous, of course, but the areas that she seems to be the most stressed and the ones that we pay attention to are right under the eyes, right here in the forehead, right under the nose, right down here on the chin. So under the eyes, this is a kidney liver area. So anytime you have more darkening under the eyes, then those particular channels of energy and corresponding organs are usually more stressed. She has no issues under the nose or chin. These are heart meridian areas, so again, more emotional areas. And we also like to look at the cheeks, where she's nice and clear. A little bit of congestion there suggests a little bit of digestive distress. So maybe there's something she's eating that she's not able to break down very well. Her liver looks a little bit sluggish, not significantly sluggish, but it's something that I, as her practitioner or my team, will be keeping an eye on moving forward. The area above the forehead is usually associated more with the gallbladder, and then the area right here at the tip of the head is usually called your shen, or your overall disposition. So if there's a lot of heat there, which I'm not feeling on her, then you're usually more wired, more anxious, angry. I know she's never angry or anxious that I can ever tell, so I'm not surprised that I can't feel a thing up here. So that's tool number one. Tool number two, do you mind sticking your tongue out for us? Okay. Here we go. All right, so here again, we're looking at her tongue. And if you can take a close look at her tongue, you see a little bit of purple right there. Very faint amount of purple. You want to do it one more time? Let's go ahead and stick your tongue out again. Excellent. A little tiny bit of purple. That purple tint to the tongue kind of coincides with the slight darkening that we see up here. That's liver meridian congestion. So does she have a full out dirty liver? No. Does she have liver congestion? Yes. And so how do I make that relate back to hormones? Well, I would want to know where her estrogen levels are, where her estrone is, how she's breaking those hormones down, and if they are working well for her body. So again, that's a tool that we use. Let's look at your tongue one more time. Go ahead and stick your tongue out. Excellent. Other than that, she looks pretty good. A little bit of biting around the sides, which again goes with the gallbladder. So all of this, I don't want to give you like this huge download on Chinese medicine, but all of this to say that when we read the face, when we look at the tongue, we actually get a lot of information about the body, specifically about the liver, and can then know that we have to chase that down. Now here's the issue that I'm seeing in practice, guys. Liver health has been ignored. And what we're understanding is that there's so many conditions today that are tied with liver toxicity and liver sluggishness. Estrogen dominance is definitely one, but it's not the only one. Did you guys know that all the sensory issues we're seeing today, the kids and the adults who can't stand sound and touch and taste and smell, and they're hypersensitive to all this stuff, they actually have dirty livers. Everyone with autoimmune disease and chronic inflammation, again, a sign of a dirty liver. We already talked about the hormone imbalances as well, but the rashes, having the little red raised petechiae on your belly or on your chest, again, a sign of a congested liver as well. The other big misconception about dirty livers is that you have to have abnormal liver levels. Well, that's simply not true. Here are some other signs on your lab work that may signify you have a dirty liver. High cholesterol levels, high levels of inflammation, which you measure usually using a SED rate, a CRP, or a homocysteine level. High levels of SHBG, alphabet soup, I'm so sorry, but that's sex hormone binding globulin. When that number gets higher, we also know that there are more issues with liver health. And then last but certainly not least, levels of fasting insulin and blood sugar. If those get super high, that poor liver, well, it has to overwork. And so that's how you can tell from facial diagnostics, tongue diagnostics, understanding a person's overall history and what they're dealing with, turning around and looking at their signs and symptoms, and then of course looking at their lab work and putting that information together. That's how we merge medicine, and really understanding that this is the path to really getting to that root cause, not just of a disease, but of optimizing someone, keeping us all superpowered, healthy, and living in our prime so that we can do the things that we were meant to do. All right, guys, I post new videos every week. Don't forget to like and subscribe, and we will talk about this more soon.